Want to pass your CCRN exam? Then let's get started. Today we'll cover 10 questions based on the neurological system. Question 1. A patient in the intensive care unit presents with altered mental status and dilated pupils. The nurse suspects increased intracranial pressure. Which intervention is the priority? Administering a sedative, elevating the head of the bed, administering Manadol, initiating seizure precautions, pause the video and select your answer. If you chose option C, you are correct, administering mannitol. Mannitol is an osmotic diuretic commonly used to reduce intracranial pressure by drawing water out of the brain tissue and into the bloodstream. This can help alleviate cerebral edema and reduce ICP. Administering mannitol promptly is crucial to prevent further neurological deterioration. Question 2. Which assessment finding indicates a potential complication of intracranial pressure monitoring? Clear drainage from the external ventricular drain, increased pulse pressure, decreased temperature of the extremities, bradycardia. Pause the video and select your answer. If you chose option D, you are correct, bradycardia. Bradycardia is a potential complication of ICP monitoring, especially when the intracranial pressure rises significantly. Increased ICP can lead to compression of the brainstem, resulting in vagal stimulation and subsequent bradycardia. Question 3. A patient with traumatic brain injury is at risk for developing cerebral vasospasm. Which medication is commonly administered to prevent vasospasm? Nimodipine, mannitol, furosemide, labetalol. Pause the video and select your answer. If you chose option A, you are correct, nimodipine. Nimodipine is a calcium channel blocker that is often administered prophylactically to prevent cerebral vasospasm, particularly in patients with subarachnoid hemorrhage or traumatic brain injury. It works by relaxing cerebral blood vessels, thereby reducing the risk of vasospasm and subsequent ischemia. Question 4. Which intervention is appropriate when caring for a patient with Guillain-Barré syndrome? Administering high-dose corticosteroids, placing the patient in Trendelenburg position, monitoring for signs of autonomic dysfunction, administering anticoagulants. Pause the video and select your answer. If you chose option C, you are correct, monitoring for signs of autonomic dysfunction. Guillain-Barré syndrome is characterized by ascending muscle weakness and paralysis, often accompanied by autonomic dysfunction such as fluctuations in blood pressure, heart rate, and respiratory function. Monitoring for signs of autonomic dysfunction is crucial for early detection and appropriate management. Question 5. Which assessment finding is indicative of Cushing's triad in a patient with increased intracranial pressure? Hypotension, bradycardia, widening pulse pressure, hyperthermia. Pause the video and select your answer. If you chose option C, you are correct. Widening pulse pressure. Cushing's triad consists of hypertension, bradycardia, and irregular respirations. Widening pulse pressure, systolic blood pressure increasing while diastolic blood pressure remains constant or decreases, is a characteristic feature of Cushing's triad and reflects increased intracranial pressure leading to brainstem compression. Question 6. A patient with a subdural hematoma is scheduled for a craniotomy. Which positioning is appropriate for this patient pre-operatively? Prone position, supine position with head elevated, Trendelenburg position, lateral position with affected side down. Pause the video and select your answer. If you chose option B, you are correct. Supine position with head elevated. Preoperatively, a patient with a subdural hematoma undergoing craniotomy should be positioned supine with the head of the bed elevated to promote venous drainage from the brain and reduce intracranial pressure. This position helps minimize cerebral edema and optimize cerebral perfusion. Question 7. A patient with a traumatic brain injury is at risk for developing diabetes insipidus due to dysfunction of which gland? Thyroid gland, pituitary gland, adrenal gland, pancreas. Pause the video and select your answer. If you chose option B, you are correct. Pituitary gland. Diabetes insipidus can occur following a traumatic brain injury due to damage of the pituitary gland or hypothalamus, which disrupts the secretion of antidiuretic hormone, also known as vasopressin. This leads to excessive urination and thirst, characteristic of diabetes insipidus. Question 8. Which medication is commonly administered to manage agitation and delirium in a patient with traumatic brain injury? Haloperidol, lorazepam, morphine, midazolam. Pause the video and select your answer. If you chose option A, you are correct. Haloperidol. Haloperidol, a typical antipsychotic medication, is commonly used to manage agitation and delirium in patients with traumatic brain injury. It helps control disruptive behaviors without causing excessive sedation, making it a preferred choice in this patient population. Question 9. Which assessment finding is indicative of a potential complication of a lumbar puncture procedure in a patient with suspected meningitis? Clear drainage from the puncture site, increased sensation in the lower extremities, severe headache when sitting upright, decreased temperature of the lower back. Pause the video and select your answer. If you chose option C, you are correct. Severe headache when sitting upright. A severe headache when sitting upright, known as a post-lumbar puncture headache, is a common complication of lumbar puncture, particularly when cerebrospinal fluid leakage occurs. This headache typically improves when the patient lies flat and worsens when sitting or standing due to decreased CSF pressure around the brain and spinal cord. Question 10. A patient with a traumatic brain injury is scheduled for surgery to evacuate a subdural hematoma. Which preoperative medication is commonly administered to reduce intracranial pressure? Acetaminophen, fentanyl, mannitol, metoclopramide. Pause the video and select your answer. If you chose option C, you are correct. Mannitol. Mannitol, an osmotic diuretic, is commonly administered pre-operatively to reduce intracranial pressure in patients with traumatic brain injury undergoing surgery for hematoma evacuation. Mannitol works by drawing water out of the brain tissue, thereby reducing cerebral edema and intracranial pressure. Click that subscribe button and join us next Thursday.